Namaste, hi. So there is a quick video for quick release for back pain, sciatica, SI joint, lower back discomfort. So let me show you some moves which can immediately help you release. So here we go. First, just to see it, lower back, you can turn on your back to the side and drop the same leg which you have a discomfort in. Just release, surrender, completely drop, completely passive to the side. This could be the back extension in a passive way. You have to release, you can hold, other hand, if you're on the table, it's just to hold. Just hang for a while. This could be the good movement. You can stay for a minute in each posture. Feel it, this release, this release. If you want, you can switch both legs though. It's good to release the both side. If you want to do same thing, you can just let it go. Ease yourself, hold and hang. This will give you good release. And then, if there is a right side of pain, right side SI joint discomfort, then be on the left side of your bed. Hold on and surrender. Just release. This release your lower back. Knee extension. Let your gravity work. Let your gravity to work. Ease, stretch, hang, and breathe. This is a very good release. Then you're coming back. If you want to release opposite side, it's good to do both side anyway. So you hold, let your leg hang, release. This really release well. You can let it go, ease. Remember, you can stay until a minute, maybe more if you want. Then coming back, one time you just hug your knees to the chest. Both knees to the chest you can do. Maybe one time hip raise, bridge, Bandhasana, join in, pushing your hip very well. This could be the good to go. And then coming back, stay with this position, make like a half lotus on the other side. This could be the good. If you're on table, just hold on so you don't fall. If you're on the bed, spread your arms and just drop this way. Just dropping in the side. Push it down if you want. Stay it, hold for a while. If the pain is this side, you can do both basically, but yeah, just to release. And then soft knee, pull down more. First was just this. Then drop down. Stretch. Pull down. This is to give you more space. If you're flexible, if you're stiff, you can be on the floor also. If you're flexible, this helps you because then your knee has more mobility to do and go. Then drop this and stretch. First is just drop. First is just this piriformis area to be released. This is good to go. And then you push down if you want to release. And then that way you come back, you release for a moment, ease yourself. Again, you just hug your knees to the chest because that is important release for your back. Hug your both knees to the chest. In between, again, squeeze your glutes. Again, you do the bridge. So in between each time, it's good to push, engage your glutes, very much tightening and strengthening because of the loosening, less strength of the hip. You feel this. Push, 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 and release. You can relax for a few moments. Touch your knees this side, touch your knees this side. So like a butterfly, and then just stretching. Butterfly and then just stretching. Ease yourself. Supta Tadasana. This could be the one in the beginning. And then release. What I want you to show another one is little bit low. So what I want you to do, you can put a bolster or some height, or you can lay down on the floor. A sofa, any couch, you can place in. Then I want you to keep your legs kind of slightly calf onto the sofa, couch, bed, and then you do the twist with this leg extension, lower leg straight, and then you twist. It will release you back again. This lower leg is straight, and then you twist and stretch. Pull your right shoulder away from you. Then coming back. Same thing, keep this leg straight. Stretch, pull down, this hand going away from you. Again, trying to stay at least 15-20 breaths in each, what I just demonstrated on table, and then this floor one. And then also you can push up, lift. This is very good formation. And then breathe. Then you turn around and you do Shalabhasana in a different way, that you can push the table, couch, and leg extension. So this knee extension, push it as strong as you can. Push the wall one leg at a time. If you're flexible, it's always good to go close to the wall, because then you can raise your leg more height. What you can do is just lying down by touching your knees to the wall. By touching your knees to the wall, you do this, and then raise your leg more slightly high and push it very well. This is so good movement for your sciatica release. Feel this, stretch, hold. Just do with the one leg at a time. Both legs could create compression, so one leg at a time. If you're more challenged, then slightly more closer to the wall day by day. And then taking a moment, coming back into the child pose. Just release yourself. Comfortable, breathe. Relax your lower back. So this really helps you. The last thing what I want you to try is finding a yoga mat or a towel fold, a blanket, any one thing. I'll just show with the blanket also. We all have a yoga blanket and towel, anything you can keep it. Now for that, what we have to do is sitting with the hip width apart your feet. So any fold is fine, and this towel is coming right behind your hip. Touch your toes, extend them, take a hand support, and lay down. Your hips are touching the ground, your shoulder touching the ground. Kneecap pulled up, legs extended. Now join your hands how you read a book, and then stretch your arms over your head. This is a very good aligned stretch for your body. Set a timer for 5 minutes if you can. It could go up to 10 minutes, remember. This is a very good stretch. Stay for a good time. Your little fingers remain touched, your palms down. Shoulders could be stiff, but don't create a gap between the hands. Don't do this, don't do this. This is fine as a relaxation, but active is this. Then you release. Normal you breathe. You release your shoulders. You lift this up, shift it under the hip, and then just one time Upanasana, knee to the chest, and release. Comfortable move for the Shavasana, for the relaxation lower back in the last, because you need some relaxation after doing all of this. Any yoga mat fold under the knees or a bolster, so that can give you a good lower back relaxation. Something mild under the head if you need to, and then you relax with this. Though there could be a very good another one if you have a two bolster or one yoga mat under your spine, one hand span distance. Drop your upper back and the towel or another yoga block for your head to surrender and relax. This is a Shavasana state. Follow this twice a day if you want. And if you have a chronic, very chronic, at least for 3 weeks. I'm sure it will give you relief in few days. And continue this until you really feel good. Let me know if you want me to make more videos, right? If you want, this is a very good relaxation and a therapy for the back pain, sciatica, SI joint. Thank you for listening. Take care.